McLaren, Northern Michigan's recent layoffs join an alarming trend around the medical industry. According to the U.S. Labor Department, 4,500 hospital jobs across the country were eliminated in January.
It was something that we had no choice to do in order to maintain our level of services that supports the greater health of this area.
McLaren's president and CEO, David Zechman, says it's partially due to patients' copay and deductibles going up, which has caused many to limit the number of times they visit the doctor.
So many patients are just not coming in for elective care, or they're waiting until they're very, very sick.
But he says the biggest dent in the budget came through Medicaid and Medicare services, changes made in the Affordable Care Act. The federal government is reimbursing these hospitals less for their services.
We still have the same costs of taking care of patients, but it's hard to keep doing the same things you're doing if you're paid less for the same amount of costs and services you provide. It's just basic economics.
Other hospitals in the region like Munson Healthcare say they too are dealing with similar issues.
Changes at the federal government level will cut about $150 million over the next 10 years from our budget. So what we're trying to do is to be proactive.
Munson President and CEO Edwin Ness says there are no immediate plans for staff cuts, but he says that many cost-cutting measures are being taken now to make sure they aren't faced with a more difficult decision down the road.
And whatever happens with the Affordable Care Act, we think if our costs are low and our quality is high, we're going to be well positioned.